Thank you all for joining us today for today's Fracture Prevention Central webinar, the 2016 NOF NBHA Qualified Clinical Data Registry. Next slide, please. I'm Debbie Zeldo. Next slide, please. I'm Senior Director of Clinical Programs at the National Bone Health Alliance, and I'm really excited to be part of the webinar today. Next slide, please. For those of you who don't know, the National Bone Health Alliance was launched in 2010 as a public-private partnership that brings together the expertise and resources of its many public, private, and nonprofit partners. Next slide. NBHA provides a platform to address the issues important to bone health. Next slide. NBHA currently has 55 members that include 35 nonprofit members, 16 private sector members, and 4 government agency liaisons. Next slide, which provides a collective reach to over 100,000 healthcare professionals and 10 million consumers. Next slide. NBHA's vision is to improve the overall health and quality of all Americans by enhancing their bone health with a focus on addressing the priorities of the Bone Health Summit National Action Plan to promote bone health and prevent disease, improve diagnosis and treatment, and enhance research, surveillance, and evaluation. Next slide. Fracture Prevention Central was launched in March of 2013 to help healthcare professionals and administrators implement a coordinator-based post-fracture FLS model of care to reduce secondary fractures and the associated costs while increasing patient outcomes. There are over 3,000 registrants to the site. Fracture Prevention Central provides a wealth of free resources, tools, and materials that we continuously add, all of which you can use and adapt to your needs. All of the fracture prevention webinars are also available on demand on the site and on the NBHA YouTube channel. Next slide. I'm pleased to introduce today's speaker, Jessica Safko. Jessica is a product manager for CE City and manages the product lifecycle quality reporting for CE City. Just wanted to have a couple of housekeeping items to cover quickly before we get started. Today's webinar will be available on demand on Fracture Prevention Central as well as the NBHA YouTube channel by Wednesday of this week. We'd also love to hear from you during today's presentation. We'll be answering questions at the end of the presentation. So please feel free to send along your questions by typing them into the question box in your GoToWebinar control panel. It is now my pleasure to turn it over to Jessica.
Thanks, Debbie. Today, we'll begin the presentation with a review of the Qualified Clinical Data Registry and also a review of the registry's measures and features. After we walk through the different features of the registry, I'll provide additional information on how to access the registry and support. First, let's take a review of the NOF and NBHA Quality Improvement Registry. The NOF and NBHA Quality Improvement Registry is classified as a Qualified Clinical Data Registry, which was introduced in 2014. The QCDR method provides a standard to satisfy PQRS requirements based on satisfactory participation. This type of registry collects medical or clinical data for the purpose of patient and disease tracking to foster improvement in the quality of care furnished to patients. The data submitted to CMS through a QCDR like this one covers quality measures which are not limited to PQRS measures across multiple payers, not just Medicare beneficiaries. Reporting through a QCDR entails reporting on at least 9 measures covering 3 national quality strategy domains with the inclusion of at least 2 outcomes measures. Now, if less than 2 outcome measures are available to an eligible professional, they can report on just 1 outcome measure and also one of the following types of measures, which are patient safety, resource use, patient experience of care, and efficiency and appropriate use measures. As I mentioned, the QCDR method is not limited to just PQRS measures. and could include up to 30 non-PQRS measures or custom measures. Now we'll review the measures available within this registry and how you can use this registry to satisfy the current reporting period's regulatory requirements. The NOF and NBHA Quality Improvement Registry is actually comprised of 46 measures, and the 15 non-PQRS measures or custom measures are listed on the table on this screen. We'll take a moment so that we can review these measures. Now this slide displays all of the standard PQRS measures which are also included in the 2016 NOF and NBHA Quality Improvement Registry. We'll also pause to review briefly the measures on this slide. The NOF and NBHA Quality Improvement Registry is accessible online through the MedCalendar platform. To review eligibility for participation in the PQRS program, review the current list of eligible practitioners. Essentially, anyone who bills Medicare for Part B covered services may be eligible for PQRS reporting. Then you would go to the website listed in Step 2 on this screen to register for reporting. The NOF and NBHA Quality Improvement Registry, in collaboration with CE City, is intended for all providers and specialties caring for patients with osteoporosis. This registry will provide participating providers with timely custom continuous performance monitors, performance gap analysis and patient outlier identification, access to improvement interventions to close performance gaps, including patient care management tools, targeted education, resources, and other evidence-based interventions, and comparison versus registry benchmarks, and peer-to-peer comparisons. After registering for the NOF and NBHA Quality Improvement Registry, you'll be taken to a measure selection page. The registry is comprised of the quality measures we reviewed earlier in our presentation, including measures for laboratory investigation for secondary causes of fracture, risk assessment and treatment after fracture, discharge instructions, emergency department osteoporosis management in women who had a fracture, osteoporosis testing in older women, and hip fracture mortality rate. As a participant, you can choose to enter data for all measures and review performance before selecting the measures for submission to CMS at the end of the reporting period. If you prefer to enter data for the minimum, you would select just 9 at least measures. The measure counter lets you know when you satisfy the 9 measures, 3 NQS domains, and 2 outcome measure requirements. You can select as many measures past the minimum requirement as you choose. Only the measure you select will be available for submission to CMS, and you will be prompted to enter data only for those measures that are selected. To ensure that the measures you select are applicable to your practice, you can download and review full measure specification documentation, which lists the diagnosis codes, the CPT codes, and other information necessary for reporting those measures. You can also click the information icon next to the measure to review the measure description as well. We will now review data entry options available through the registry. Data services are available within this Quality Improvement Registry. The NOF and NBHA Quality Improvement Registry comes standard with data entry through online forms as well as data uploading capabilities. Additional data services are also available, such as integration with your EHR or through data loading. To add patients manually using web-based forms, you would click the Add a New Patient button from the Data tab of your registry site. To complete data entry via the online forms, you would simply input eligible patient information through the web form which is provided in the tool. With each patient entry, you would input the requested information. The requested information includes the encounter date, related codes billed for that encounter, and questions which regard that specific visit date. You would continue to add patients and encounters until you've entered at least 50% of your eligible patients per selected measure. As you enter each patient and encounter, your progress will be updated in the data dashboard. If you would rather upload your data into the registry, you would click the Upload Patients button. To begin that upload process, you download the templates that are available within the registry. These include the data template and the definition file. The following slides illustrate the data upload process. Please do note that if you have difficulty uploading your data, resources are available to you through the CE City support team. The support team can be accessed by clicking the support link on the MedConcert website. When uploading, you first download the data template. Note that the template has been updated for 2016, and you shouldn't use a template from previous years. The template contains the correct column and row headers which correspond to the required data elements. Place the appropriate data into the templates and ensure that the columns match properly. Editing template column headers may cause errors during the upload process. The definition file is also available for you to download for assistance with populating the data template. The data template is the file that you will populate with your encounter data. You can populate the template in any way that you choose. It can be populated through automated reports set up in your electronic system or even manually. The template should be downloaded and saved with the information that you extract from a patient's chart or your electronic system. The definition file provides instructions and specifications for populating the data template. After your data is collected within the spreadsheet, you can upload your file. Ensure that you save your files in a location where you can easily retrieve them when you're ready to upload, and remember to back up your files in a secure location. The data upload queue appears when you upload a patient or data file. You can review all of the information that you've uploaded into the system through this queue. This will give you information about valid reports that have been successfully uploaded, and if any errors were encountered, the data queue produces error files which define any entries which might need to be removed or updated. Now, if you'd like to add an encounter to a patient that's already been entered into the registry, you would simply click the Add Existing Patient button. To add a visit or encounter to a patient that already exists into the registry, you can search by them with their name or ID numbers. Once you locate your patient, you then click the Add Encounter icon to add a new visit or encounter to that patient. Now we'll walk through the performance management features within the NOF and NBHA Quality Improvement Registry. To manage your registry performance, click the Performance tab of the Registry dashboard. The registry will calculate and display each measure and quality score in the Performance Monitor. Additionally, the registry can generate performance measures gaps and lists of patient outliers, as well as a link to interventions and improvement tools. The registry is configured to aggregate measure scores at the measure level on a daily basis. The registry provides analytics at the provider level. What you see pictured here on this screen is the provider level dashboard, which includes each measure being tracked, the performance score trend lines, quality measure scores, measures gaps, which are compared to practice and national benchmarks when available. Quality improvement is configured at the measure level. Let's now review how to improve performance through the NOF and NBHA Quality Improvement Registry. Once a measure gap is identified, the Quality Improvement Registry automatically identifies improvement interventions. The green How Do I Improve button associated with each measure links to relevant improvement tools, including relevant clinical guidelines and continuing education materials. Your patient population is broken down by patient within the registry. We will now overview the patient list and alerts by patient and measure. The master patient list includes the list of patients loaded into your registry. Review the Alerts by Patient section of your patient population to identify patient outliers. The indicators you view here represent the most recent updates made to the registry for each patient entry. By reviewing the Alerts by Measure section, you can review feedback at the measure level, as well as the measure score broken down by patient within that measure. Now we'll review how PQRS, maintenance of certification, and meaningful use specialized registry reporting can be satisfied with your registry data. First, we'll review PQRS requirements and reporting through this registry. The Physician Quality Reporting System, or PQRS, is a quality reporting program that encourages individual eligible professionals and group practices to report information on the quality of care furnished to Medicare patients. By reporting on PQRS quality measures, individual eligible providers and group practices can also quantify how often they are meeting a particular quality metric. PQRS is considered a pay-for-reporting program. Beginning in 2015, the program began to apply a negative payment adjustment to providers and group practices who did not satisfactorily report data on quality measures for Medicare Part B physician fee schedule covered professional services. For example, those who did not comply with the 2015 PQRS program would face a negative payment adjustment or penalty in the 2017 calendar year. The NOF and NBHA Quality Improvement Registry is approved by CMS as a Qualified Clinical Data Registry, or QCDR. Again, QCDR is a registry comprised of PQRS and also non-PQRS approved measures which qualify as a CMS-approved reporting tool for PQRS. This registry is a QCDR with quality measures that include custom quality measures designed specifically for practitioners providing care for patients with osteoporosis. To satisfy PQRS requirements with your registry data, you would ensure that at least 9 measures are selected that cover at least 2 outcome measures and 3 national quality strategy domains. Of course, you will report on 50% of your eligible patients per measure and complete an attestation before submission to CMS. You can see that there are several types of providers who are eligible for PQRS. As I mentioned previously, you'll notice that it's not just physicians. It's for any of the providers that you see listed here on this screen, essentially anyone who's billing Medicare for patient encounters in the 2016 current calendar year. Please note that eligible providers should report with encounters billed through their NPI tax ID combination. Only encounters billed by a respective NPI tax ID combination should be used for PQRS reporting. The value-based modifier provides for differential payment to an eligible provider or group under the Medicare physician fee schedule based on the quality of care furnished compared to the cost of care during a performance period. The value-based modifier is an adjustment that's made on a per-claim basis to Medicare payments for items and services under the Medicare physician fee schedule. It is applied at the tax ID level to eligible providers billing under the group's tax ID. The QCDR reporting mechanism can be utilized by both individual reporting providers as well as GPRO group practices. 2016 marks the first year that a GPRO practice can utilize a qualified clinical data registry, such as the NOF and NBHA Quality Improvement Registry for PQRS reporting submission. To report as a GPRO, self-nomination with CMS is required. The time frame for 2016 CMS registration or self-nomination is in the time window between April 1st of 2016 and June 30th of 2016. Once a tax ID is registered as a GPRO with CMS, the election is not able to be changed after the June 30th of 2016 deadline. Reporting as a GPRO requires a group to select the reporting method as either an EHR, registry, QCDR, or web interface. To report through the NOF and NBHA Quality Improvement Registry, the QCDR option would be selected during self-nomination. To recap, to avoid an automatic 2% negative adjustment, all eligible providers should successfully complete PQRS reporting for the 2016 reporting period. Depending on the size and type of your group, there is up to a 6% financial risk for non-compliance with the PQRS and value modifier programs. For the 2016 reporting period, under the value modifier quality tiering program, groups of 10 or more physicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists may be subject to upward, neutral, or downward adjustments of up to 4% in either direction based on their cost and quality scores. Looking at the current performance year, we see that PQRS meaningful use and the value modifier close out after the 2018 adjustment year. And beginning in program year 2017, the proposed merit-based incentive payment system, or MIP, begins and consolidates PQRS, the VBM, and MU into the value-based performance payment program. A majority of providers will fall into track 1, which is MIPS, and a smaller percentage of providers are projected to fall into track 2 as the advanced APM participants. NACRA consolidates and expands pay-for-performance incentives with the fee-for-service system, creating the new merit-based incentive payment system, or MIPS. The program is designed to be budget neutral, so total negative adjustments across all providers will equal total positive adjustments across all providers. In addition, high performers are eligible to share an additional pool of bonus funds allocated by the law. In 2019 and 2020, participation is restricted to Medicare physicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists. You can see here on this slide that MIPS components relate to the programs we are familiar with today. Quality relates to PQRS measures, resource use relates to the value-based modifier, and advancing care information relates to the meaningful use program. Now, let's move on to the Maintenance of Certification Program, or MOC. Maintenance of Certification, or MOC, acknowledges the growth and complexity of medical science, clinical care, and the importance of the physician's relationship with the patient in delivering quality clinical outcomes. It also requires proof that a physician has practice-related knowledge to provide quality care in a particular specialty. This registry supports the submission of data for maintenance of certification purposes. To satisfy MOC requirements, see the MOC section of your NOF and NBHA Quality Improvement Registry account. Finally, we will review how you can satisfy meaningful use requirements through the NOF and NBHA Quality Improvement Registry. The NOF and NBHA Quality Improvement Registry, in collaboration with CE City, is currently accepting data from eligible professionals to fulfill the Meaningful Use EHR Incentive Program's public health objective, which is submission of data for specialized registry reporting. To meet this objective, providers are requested to electronically submit data from Certified Electronic Health Record Technology to the NOF and NBHA Quality Improvement Registry. If you are interested in submitting data to the NOF and NBHA Quality Improvement Registry for the satisfaction of this public health reporting objective, please complete and submit a request to CE City from medconcert.com/FractureQIR. Debbie, I'd like to turn it back to you for some closing thoughts before we begin our question and answer session.
Great, thank you, Jessica. Just a reminder for those on the line to please type in any questions that you have into the question bar, and we'll be able to answer them before the webinar ends. The one question I see, Jessica, is whether people would be able to download their data once it has been put into the QCDR. So if they've entered the data or uploaded the data, can they also download the data into an Excel spreadsheet?
I do not believe that you can export manually entered data into the registry. If data is loaded into the registry via an Excel file, in that data upload queue, you have the ability to download any files that were uploaded into the registry. Of course, if information is requested, we do have a support team that's available to participants that could assist with any requests of that nature.
Great, thank you.
Sure.
Okay, we have a question. What is the annual cost to use the registry? And I'm happy to talk to the piece around using the registry to report PQRS as well as enter the data. If you're a member of NOF, it's $500 per reporting year. Is there anything else on that end, Jessica, that you wanted to add around the costs?
No, I don't have anything additional there.
Okay, great. Well, it does not look like we have any further questions. So first, I want to thank everyone for joining us this afternoon. And Jessica, thank you so much for a wonderful presentation. As a reminder, the webinar will be posted on the Fracture Prevention Central website on Wednesday, as well as posted to the NBHA YouTube channel as well. Thanks so much and have a wonderful afternoon.